Hey guys, how are you? Welcome to my channel. This is just a quick video to go over some side effects of levothyroxine or Synthroid or Levothyroid or whatever kind of thyroid medication that you're on that was not prescribed by a naturopath. My name is Brittany and I'm a metastatic thyroid cancer survivor, and this video just will be quick and informative. I do want you to know that as an individual person, not all people handle medication the same, so even though these side effects are likely, you might not specifically have these things occur. So disclaimer there, I just wanted you to make sure that you knew so that we could all be friends and hopefully get along and not have any misunderstanding. So the first one, and there's only going to be 3 side effects that I'm going to talk about today. This is going to be a very short and informative video. The very first side effect that you might know once starting levothyroxine is weight loss. I was actually quite worried that I would gain a bunch of weight once starting the medication, and that can happen a little bit when you actually have your thyroid removed. People's weight can fluctuate for quite some time. It usually does normalize once your medication is where it needs to be, but levothyroxine actually causes weight loss. It really speeds up your metabolism. It gets your body into doing something that it's never done before correctly. So once you're more normalized, your weight should go back to normal. But in a lot of patients, in a lot of cases, you actually will lose weight. I lost some weight after having my thyroid removed because my cancerous tumor was not letting me metabolize food correctly. So I did end up losing weight after that surgery, but once I started levothyroxine, I lost about 5 more pounds. So I completely went back to my normal weight. That does not happen for everybody, but please don't worry that taking levothyroxine will make you gain weight. It actually will more than likely do the quite opposite effect. So there's that. The next one I want to touch on is honestly not very comfortable or good, but it's insomnia. You will likely notice that once you start levothyroxine, especially if you're on a very high dose, or people with metastatic thyroid cancer or people who have lost their thyroid tend to be on higher doses of levothyroxine, and those higher doses are the ones that tend to make you lose a little bit more weight than normal or lose a little more sleep than normal, unfortunately. So whether you have lost your thyroid due to a disease or have lost your thyroid due to cancer like me, or just have one that's generally a piece of crap, levothyroxine might keep you up. It is something that you can talk to your doctor about. Just like with the weight loss side effect, it's only temporary. It doesn't tend to usually always last. So keep that in mind as well. It's not something that you really need to worry about. It should level out. But just talking to your doctor to see what options there are for you. Usually natural things like magnesium and a melatonin supplement that I take right before bed tends to help me on the days where I have a really fast heart rate due to the insomnia of the drug. But I also have a fast heart rate and have insomnia due to other things, so it's not necessarily levothyroxine's fault. The last thing I want to touch on is, something that I don't want you to be alarmed about, but it is a fairly common side effect, and that's hair loss. Now, when I was losing my hair initially, a lot of people thought that it tended to be more because of chemo. People unfortunately usually associate cancer with chemo or chemo with cancer, and I did not lose as much hair as your typical cancer patient would lose. It did come out in the chunkfuls when my medication was rising. Every couple of months I was getting a stronger dose, so it was not completely falling out. I do want you to keep that in mind, and I don't want to put out the idea that you're going to lose all your hair like a chemo patient would, or somebody using that treatment. Levothyroxine just, like I said, speeds up your metabolism. Things are trying to get normalized and level out, and hair loss does happen to be a side effect for people on very high doses, even people who are on smaller doses, but I promise you this will level out just like the other two. I was a little self-conscious about this initially, but once my body started getting used to the drug, once my medication was that I take 112 micrograms of Synthroid. I've been on that medication and that dosage for over a year. Once that stabilized and my meds weren't rising any further, my hair loss stopped, the weight loss stopped, and so did the insomnia. So all of these things are very temporary. Please do not worry. Please talk to your doctor if you have any reason to think that, you know, what you're experiencing isn't normal, or you feel like it's just been a really long time and something's not right. Always communicate with your doctor. Always tell them what your worries are, and everything will be okay. You have to communicate with your doctor. You have to advocate for yourself. That is the number one thing that I stress to all of you, and it saved my butt a couple of times. So thank you guys so much for watching this video. If you are a thyroid person like I am, a thyroid advocate or cancer patient, or for whatever reason, I would really appreciate a like or a thumbs up. I'm not going to beg for subscriptions because I've tried doing that and just makes me really uncomfortable. So I hope you have a blessed day. I hope that you're staying safe in quarantine, and I will see you guys in my next lighthearted video. Thank you. Many blessings to you guys.